Welcome everyone to our careers in nutrition and public health. We're going to start, like I said, there is a class here of students, so I promise they are here in the room. And then I also have Dr. Emily Haying here in the room as well. So her and I are going to tag team. I think the three of you know her better than me, better than you know me. You also probably know her better than I know her as well. And so we're going to tag team. And so I'm going to just kick us off. And I would love it if the three of you, in whatever order you feel like works for you today on this Wednesday, to just start with the basics of what's your name, what was your major, and like a brief snippet of what are you currently doing. And then what we'll do is we'll loop back into what are some significant things you did while in undergrad, while you're here at St. Ben's and St. John's, to help prep you for where you are today and a little bit more about that path. So again, for starters, I'll have you like, what's your name? When did you graduate? What was your major? And then a little snippet of what you currently do today. Who wants to start?
I can go. Can you all hear me? Awesome, thank you. All right, so my name is Tessa Laswell, and I use she, her, hers pronouns. And I graduated from St. Ben's in 2015, and I was a nutrition dietetics major. After graduating from St. Ben's, I went to the University of Minnesota, where I completed my dietetic internship and also completed a master's in public health nutrition from the School of Public Health. I was at the University of Minnesota for a little bit, and then I transitioned to the U.S. Department of Agriculture in 2021. And right now I am working there in the national office in the Center for Nutrition Policy and Promotion, where I'm on the nutrition guidance team supporting the dietary guidelines process.
I can go next. My name's Liz Burning. I graduated in 2019 with a nutrition major, psychology minor. After graduation, I did about a year working at the Emily program in one of their residential buildings. And for the past 2 years, I've been with Second Harvest Heartland doing patient coordination for the Food RX program, which is like it's like a box program aimed to help teach people how to manage their diabetes and heart conditions through diet.
All right, and I'm Holly Kudrowski. I graduated in 2018. I was a nutrition science major, and I went to the U of M after graduation for my Master's of Public Health in Community Health Promotion. And I currently work for the Minnesota Department of Health, looking at vaccination data.
Thank you all for that introduction. I'm excited to dig a little bit more into how you got from here to there. But first, let's start. Your current day-to-day jobs look really, really different, but you all had a little bit of a similar base in terms of academics. We'll dig more into kind of the academics and the how you got from here to there. But first, I'm wondering if you can talk about significant experiences defined by you that you did while you were here at St. Ben's and St. John's, whether it's a class, whether it's research, study abroad, whether it was an internship, whether it was a student organization. What were the significant things that, looking back, you say, gosh, that was really important for me? Again, any order. I won't call on you.
I can start this one. So at my time at St. Ben's, I worked at Clemens Library for about 3 years, and I think that one really impacted me a lot. Just I really love to learn, I really love to interact with people, and it exposed me to a lot of different members of the community, or just ways of thinking, which I think was really cool to experience. My junior year, I also did a semester abroad in Australia, which was really life-changing, amazing, more so on a personal aspect than a career aspect, but still awesome. And then I was also a part of the women's choir all 4 years on campus, and again, more of a personal experience, but still amazing.
I'll go next. So I think the first thing that comes to mind, and it always seems to come to mind, is my study abroad experience as well. I studied abroad in South Africa, and that was huge for so many reasons for me. And that was actually the first place that I credit with fully grasping onto what public health was. I remember I was working in one of the schools there, and I was seeing the students eat breakfast in something that looked kind of like a pink, like double bubble meats bologna situation. And I could like see that it was hard for the students to swallow in terms of like palatability. And I also then was seeing students struggling to focus. And I was like, there has to be some connection here. So that was really one of the first things that opened my eyes to public health as a discipline, and thinking about how nutrition can be implemented on more than just an individual level. And then when I returned from South Africa, I did some research with Dr. Amy Olson, who is in the position that Emily is now in. And I was looking at iodine levels in women of childbearing years, or the college age population. And I use a lot of my research skills now at my USDA job. I did at the university. I do in some other projects that I'm doing on the side. And it was those things together that really helped me understand what public health can be, and look at it as something that is impacting everybody and can be taken in many directions.
So my story is similar to the other two as well. I guess my first experience with public health was while at St. Ben's was actually in my ethics class. So I took medical ethics, and we did like a public health unit and learned a lot about Paul Farmer and all the work he does on the public health side of things. And then on top of that, I studied abroad in London my junior year. And part of the London Study Abroad program is that you have to have an internship. And so I selected a public health internship, and I got to go work in the community. And I worked for, it's called Healthy Heart. So it's a cardiovascular disease prevention program in the UK. And so I got to go work in clinics, go to community events, and do one-on-one consultations. And that just really solidified that public health was the way I wanted to go. And that's where my interests lie more than what I was studying before. And then I came back from study abroad, a few classes that just helped solidify that. Emily actually taught, can't remember the name of it, but it was like a global nutrition public health type course that I just remember being so engrossed in my entire semester that I had it. And then also my research project. So I did a research project on student perceptions on GMOs, and through all of that work and all of that process, I learned a lot of research skills that I currently use in my job. And so that led me to where I am, and I still get to do research and work with providers, which is really nice.
Thank you, I appreciate that. A couple of you talked about that first time, or like as you started to understand what is public health, right? Because whether it's from a nutrition standpoint, a dietetic standpoint, like different angles, I'm wondering if you could talk about what role you see things like nutrition or dietetics playing in public health, and or like what is public health and why do we need it? I mean, it's kind of a softball question.
How much time do we have? Because that, like, we could be here all day with that one. I can start unless
So like Tessa, you're unmuted, so you're it.
I guess I'm going. Okay. So I mean, I think this probably goes without saying, but public health, especially after the COVID, or I guess we are technically still within the COVID-19 pandemic, and thinking about public health measures are really important in that. And I oftentimes think public health is really tricky to quantify, right? I think that sometimes we want prevention, and then when we don't see something happening, we say like, oh, but the public health was crying wolf, or we made it worse than it is. But right, prevention is something that it's hard to see because it's not happening, right? And so I think just figuring out how we can talk about that and how we can really switch to more of a treatment to a prevention mindset. And when it comes to nutrition, I think that, to me, you can't necessarily talk about nutrition without talking about public health. And I don't think you can talk about public health without talking about nutrition. And I think especially this is coming up in a lot of the work that I'm doing. I attended the White House conference on health, hunger, nutrition, and health a few weeks ago. And one of the big tenets of the White House's strategy is related to health equity and the social determinants of health. And I really think that that is cornerstone to public health and something that we need to keep looking at, especially when it comes to nutrition and how we eat, and how does food access and availability impact how we are designing our policies and providing care.
I think Tessa summed it up really well, but just to expand on that a bit more, the reason I chose to major in nutrition is nutrition is such an integral part of health, and there isn't just one thing that determines someone's health. It's a combination of several things, and I really liked the idea of almost those unconventional approaches to improving someone's health that aren't as obvious as going to the doctor or seeking primary care. And so that really propelled me into my public health career. And now working on vaccination data, we use the social determinants of health for everything. You know, when we look at certain areas of the state that have low vaccination rates, it's not just that those people don't care. It's not just that they aren't going to the doctor. There's several things that are going into it, and nutrition is the key part of it, as well as transportation. What is the what are the demographics of the county? You know, like, is there a lot of public transportation available? Is there a clinic near them? It's just a combination of a ton of things that make up someone's health, and public health is all of those things. And so I think Tessa's right that you can't talk about public health without talking about nutrition, and vice versa, because they are, you know, the same thing essentially.
And I would echo everything that the first two said. I guess in my work, the social determinants of health really are at the forefront of our work. In food banking, you know, we deal with people who are experiencing food insecurity, and, you know, reaching food security for people a lot of times does not reach the outcomes that, you know, one would associate with health. So, you know, the transportation, the access to medical care, all of those other things make up the total package of achieving health, and nutrition is a large part of that.
I very much hear all three of you, right? Like, public health is this intersection of so many pieces. It's not this singular lens. It's this very multifaceted, which very much reminds me to, right? Like, you came into these professions with degrees from a liberal arts institution. So I'm wondering if you can talk about what specific skills, kind of from that liberal arts, broad-based education perspective, like what skills do you feel like you're applying in a day-to-day basis? And in what ways do you feel like you acquired those while you were an undergrad, or are still acquiring them?
I can start with this one. So I graduated in May of 2019. So really the beginning of my career was right when the pandemic first started. And I was in a mental health care facility at that time. So that was very challenging to start my career off. I think a liberal arts degree taught me to be a really good problem solver and to approach, you know, problems with multiple solutions. And I think it's given me an open mind enough to do that and to see multiple solutions to the same problem.
I can go next. So similar thing. So I think that really the main thing that my liberal arts education gave me was an open mind, to know that everyone I talk to and everyone I encounter has experiences that I don't necessarily have, and their input and their experiences are just as valuable as mine. And I can learn from everyone I encounter, especially when talking about community health and like working with communities. No one's going to know what's going on in that community more so than the community members. Same thing with, I work with some tribal health orgs. I'm not associated or affiliated with the tribe. And so I do not pretend to know that I know what the tribe members are experiencing. I leave that to our tribal health liaison, because they work with the tribes, they're integrated with the tribes, they know what they're seeing, and being able to meet them where they're at and support them in their work, and knowing that even though I'm, the Department of Health employee and I'm the one that's pulling this data, I am not the expert, they are. And just being open to humbling yourself a little bit and being open to input from others and letting others take the lead when they really need to.
I love both Liz and Holly's responses, and mine is in the same vein. Angie, one of the things that you asked us to think about coming in here was, what are some skills that we use in the profession? And something that came to mind a lot was around stakeholder engagement. Stakeholder is probably one of the buzziest of all the buzzwords in public health, which is just essentially thinking about who is affected by the issue, who are the people that care about it, and how do you engage them. And I think that stakeholder engagement, the key to doing that is relationship building. And I think that that is one of the skills that I credit a lot to a liberal arts education, especially at St. Ben St. John's. I think that the ability to connect with folks outside of my specific major and take classes outside of just nutrition and the hard sciences, but really think about communication and thinking about the arts in it. Like, I think that allows me to be a little bit more creative when I'm thinking about public health solutions, and I'm thinking about engaging all of the folks that need to be at the table. And yeah, I think just like taking a step back and allowing and thinking about who's not at the table and needs to be. I think that St. Ben's primes us for that from day one.
I appreciate that. And like, to all of you in the room, my hope is you see, right, like as you're going through these motions, right, like taking classes, going to class, writing papers, taking tests, maybe sleeping a little bit, maybe not, that like for you to hear directly from people who were in your seat not that long ago of like, this is the why, like all of the fabulous papers you get to write. All of those things that it's based in. We here at St. Ben's and St. John's are working on developing skills from this really broad angle. And then, how and where you apply that, you've got lots of different options, but I appreciate all three of you, how you articulated the skills, because that's why you're doing all the stuff you're doing right now. Did you want to, Emily's going to come in and ask a question. We're tag teaming this.
Hi, friends. Okay, so thank you so much for being here. And I just want to say, like, some of the thoughtful things that you're saying make me so proud. I've like been beaming under my mask, hearing you talk about like the social determinants of health and kind of what public health is. Because some days I feel like I want to lose my mind when it comes to like this idea of public health. Sometimes I feel like it's becoming a buzzword for it too. So to hear like the work you're doing every day, like I'm just like really proud. And to like all the students here, like these are three amazing people who are doing amazing like work. And I just feel so strongly about how I'm like, you can do so many things with public health, and it really comes back to those social determinants of health, relationship building. I also kind of I heard this quote about a year ago called "Ask the Other Question." Like even when you have a success or something like that, like ask the other question, like who wasn't this a success for? And these things, and I've been like thinking about that throughout when you all have been speaking. So A question that I would like for you to talk a little bit about a minute each for the students is, can you talk about what you do like day to day in your job? Sometimes I think, even myself, when I hear about what students are doing, I remember Holly, when we talked before, I was like, Holly, what do you do every day? Like working with those things for that. And so could you just tell them a little bit? Because I think it's helpful for people. I just remember, like I teach in a dietetics program, and until I did my dietetic rotations 2 years ago, I couldn't tell you the nitty gritty of really what a dietitian did for that. So I feel so strongly about talking about kind of the nitty gritty. So can you just talk about like 3 or 4 things that you're kind of doing daily in your job, like tasks that could kind of help the students figure out like, what would I be doing if I had this position?
I can start. So I think my job is kind of approached from 2 different sides. The one side, my role is really heavy in the patient engagement. So on a daily basis, I'm either cold calling or following up with members that I'm trying to enroll into the FoodRx program, or checking on their progress throughout the program and making sure that they're understanding the material that they're receiving, and that if they have any health related questions, that I can direct them in the correct direction. So patient coordination is one, so that comes along with all the charting, all the fun stuff, all the documentation. But I would say the other big part of my job is really project management. So FoodRx, we partner with health plans across the state who administer their program as a part of their benefits package. So really, again, that relationship building piece with those external partners who aren't in the day-to-day, but they're the ones that are, and technically administering the program. So making sure that they're all set and that we're coordinating care between the health plan and the end user, I would say is probably the other big tasks on my day-to-day.
I can go. So I just want to put the caveat that the work surrounding the dietary guidelines, which, side note, sometimes I'm like, I love that. I love my job because I'm like, we've learned about the dietary guidelines. I remember like sitting in RDOF and learning about them, and now getting to work on them is pretty cool. And so a lot of this work is process-based because they're updated every 5 years, and the next ones come out in 2025. So right now we are in the process of almost announcing the committee that is going to be reviewing all of the evidence. And so as we're doing that, one of the tenets of the guidelines is transparency with the American public. And so a lot of my job right now is getting the website in a place where we're able to update it based on where we are in the process. So we're viewing a lot of content, working with one of our contractors to get the website in a pretty place. If you want to go and look at what I'm doing, you can go to the dietaryguidelines.gov. And then I think other things that I'm doing is something else that I don't know if any of us have really talked about, but maybe goes without saying, is that so much of the work is collaborative. So working with teams on different reviews of papers to decide if we should include them or exclude them, and looking at the evidence, working right now I'm working on a manuscript about major misconceptions about the dietary guidelines. Yeah, so it's kind of a little bit of everything, which is not super helpful. But yeah, a lot that goes into the process of getting the dietary guidelines in a place where they can be released in 2025.
All right. So my position, I'm actually an epidemiologist, which is a big word that says I do a lot of things. So my day-to-day work can vary, but there's like 4 tasks that I do mainly and mostly every day. So the first is I actually work for Immunization Information System, which is a statewide database for all immunizations or vaccines given in the state. And so one of my main tasks is I have to help maintain our database and our web application. So I have to work with IT and with our partners to make changes as something breaks, or if a partner would like a new feature in it. And so I do a lot of collaboration with both of our partners and our IT staff. Another thing I work on is what we call a reminder recall. And so we send immunization reminders to people who are overdue or recommended for specific vaccines. So it can be to kids who are overdue or recommended for the school vaccine series. It can be adults reminding them to get a flu shot, anything like that. And so I do a lot of project management and planning in those to see what vaccines we want to target, what age groups we want to target, and then actually pull the data and compile the materials to send them out. And we send them out through both mail and text message. And then another thing I do is what's called our public inquiry team, or a public inquiry program. And so I work directly with the public, fielding questions about their immunization record, if they want to change their privacy settings, if they have any questions about their MIC record or anything about vaccines. So I do a lot of communication and a lot of de-escalation as well with the general public on that. And then the main thing I do is data analysis. And so I look at vaccination rates and I compile a bunch of charts and visualizations and share them with key stakeholders. So those change based on who the stakeholder is. So I make graphs for everyone from local public health to providers to tribal health partners to all the way up to the governor's office. And actually, if you look online at our COVID data, that is actually a chart that I helped create. So also sharing the data with the public. And so that in itself uses a lot of skills, data analyzation, data summarization, as well as communication, because for every group of stakeholders that we share with, it needs to be worded slightly different. The words that we use with healthcare providers are not the same words that we'll use with the general public. And so being able to adapt and communicate across a variety of populations and variety of knowledge levels is very important.
Thank you so much. Yeah, I do chuckle a little bit when I hear the term, like, yeah, stakeholders becoming a buzzword too. I always feel like when it comes to when I'm presenting the food insecurity data and we're trying to, create a more food secure campus here, I feel like I have to turn on the stakeholder term when we, when we get to the top and we're asking for money. But I think it's so important too to also consider who are our stakeholders these days. I feel like all of our communities can be considered that as well. So yeah, thank you so much for sharing. I love hearing about like what you do day to day for that. The last question I have, and then I think we'll maybe ask some other questions. So students, friends, if you have some questions, we'll leave some time for that. So be thinking of some good ones. Can you tell them like what piece of advice do you have for like one, either figuring out what you want to do, or two, like getting into grad school or getting a job? And I would like it to hear, like you to go a little more in detail than just say kind of get involved, because I think getting involved is important, but can you give them something like get involved with who, or like what resources did you seek out to help you? Because either just get a job or even kind of the graduate school thing you could talk about either. So like what's like one piece of advice?
I can go first. So I guess to put it simply, one piece of advice would just to say yes. Both my senior year at St. Ben's and also in grad school, I started networking, which is something that most people, don't love, but I didn't love it at first, but through that, I just made different connections. So I had a friend who connected me with a coworker of her dad's who happened to be in charge of SHIP, which is the statewide health improvement program, I believe, which are county level programs, mostly county level. And so I had an informational interview with him to learn more about his job and how his organization works with those. And then in grad school, just a ton of informational interviews about what people are doing, where they're working, anything that I saw that I was like, oh, that sounds kind of cool. I would reach out to them on LinkedIn, or I'd set up a meeting to talk to them and to see what their day-to-day activity looks like and see what they do. And then as far as getting into grad school, I would just say be open to other things. So I didn't know about public health, and I was dead set on going into the healthcare field and working in a clinic. And then eventually, as I was slowly exposed to public health, I decided to look more into it and then eventually apply to grad school. And so I kind of had this gut feeling that maybe public health was a better suit for me. And I reached out to the U of M. I did an open house there and learned about the programs and realized that that is what I wanted to do. And that's a path I wanted to take. And it's all because I just said yes to meeting my friend's dad's coworker. So that would be my advice. Just be open to other things and say yes.
I can go next. And this is something I'm still practicing as well. It's not something that comes easy to me, that networking piece. But I would say connections is definitely a big one. I think utilizing the Benny Johnny network has been really helpful for me. Getting my first job out of college at the Emily program, I interviewed with a Benny, and I replaced a Benny in that position. So having that network built into a lot of the nutrition in the public health field has been really helpful. I guess also one strategy I've used, and this is totally random, but the two jobs I have gotten to also have just kind of fallen in my lap because I Googled things. So like if I was driving down the road and I saw like a billboard that was associated with food or an organization that looked like it was aligned with health, I would just Google their website and see what it was about. And I think just doing that research exposed me to a lot of different organizations, and you find yourself down a rabbit hole of just an endless loop of connection there. So I guess the Benny Johnny network and just being curious, I think, of the possibilities, because there's a lot.
So I think Liz and Holly have really hit or driven home the network and connection piece. So I'm gonna bring it to like when you're applying for a job, and I just want to call out imposter syndrome, and I feel like that is very real, and I feel it, and I've talked to peers that have felt it, and something that I am better at encouraging peers to do than I am myself. I'm trying to practice and take my own advice, is that oftentimes you do have the experience. It may just not be exactly what is written in the job description in the bullets. And so before just like saying, no, I haven't worked as an epidemiologist before, or worked on vaccines, or worked on the specific food prescription box, like what are some of the skills that are transferable from your other jobs that you can take with you? I mean, when I was thinking about this, like I worked in a coffee shop, and like what are some of the skills that I learned in like working with customers that I think can be communicated well and like applied to a public health job? Like I'm not saying to lie by any means, but I think just like being really intentional and being able to see that some of these skills in relationship building, in being innovative, and being able to make connections are really valuable. And I think if I was hiring somebody, I would want to see them be able to think critically about like how this one skill can impact your job in public health. Because I also know it can be really frustrating, especially when you're getting out of school, to like apply for jobs that say like you need to have experience to get experience, and it's a bit of a face palm, right? Like how do I do this? So I think just where you can, being able to tell the story and control the narrative to show that you are qualified and can learn too.
I could not have said it better. I love that though. I love how all three of you really talked about the transferability, the skills, that there are, you have your own story, and how you've gained those skills, even from when we talked earlier, and how those skills show up day to day look different. But that means you have them and you can apply them in a setting that you may not have thought about before. And I love both Liz and Holly. I appreciate that you both talked about, and you said the networking word, right? And so I really appreciate, because often what we'll talk about in XPD is it's making connections. Because networking, how many of you in the room sounds scary, right? You're like, no, right? So there's a lot of hands up. So it's like, but as what you heard people talk about, would you be willing to have a 20 to 30 minute conversation with someone to hear about their own path? That feels easier, right? And so that is network. Like, think of it as you're gathering information. That's all it is. You're not often leaving that conversation with, so by the way, are you going to hire me? You don't ask that. Like, it's truly, it's just information gathering. So I appreciate you all. And Holly, were you going to add something?
Yeah, I'd say a lot of that also is just grabbing coffee with someone. I've grabbed coffee with so many people over the last few years and just learned about what they do. And people love to talk about their jobs and what they do. So it's really approachable and everyone's done it. And so if you ask them, they're most likely going to say yes, and you get a coffee out of it. So.
Well, and then I think too, it actually ends up helping them. Like, I've done that and I've reached out to folks. I'm like, can we just chat? And then they're like, yeah, cool. We don't have anything right now. Like, not even me like asking, but I'm like, I'd be interested in working at your organization. They're like, yeah, cool. Like, well, like, be in touch. And then I've kind of forgotten about it. And then like a month later, it showed up in my LinkedIn inbox or like my email. And it's like, we have this job, because so many times positions are like, if you know of anybody, like, pass it along to your networks. And so it's actually helping the person that you're connecting with too, because they now know a little bit about you and can kind of facilitate that connection and target an application towards you.
I love that. It's almost this version of, instead of Googling on a computer, right? Like, it's like an in-person Google, where you have Google in front of you because that person is the expert on themselves. So like,
Right.
ask them anything and they're going to know.
Yeah. And I think in that way too, I remind myself about this sometimes, and it helps with my nerves, is that you're interviewing the organization too, and you're interviewing them. Like, that's really important. And I think that's something else I got from St. Ben's, is like really being intentional with what my values are and knowing what's important to me in a job, so that when I do get a job and I'm like, okay, like, this didn't feel super great in this informational interview, or I didn't love the way that this felt, I know what's important to me and what I want, so that I can help too. I think sometimes we just think like, I'll take anything. And I feel like St. Ben's and St. John's have set us up to be like, this is where I am, I'm prepared, and I can make a more informed decision.
I love that. I appreciate that. So we have about 15 minutes left. So I want to turn it to our audience. And so I want to know what questions you all have. You have two choices. You can either come up here and introduce yourself in the mic. I promise they're not going to eat you, like, right? You're good. Or feel free to ask the question and I'll do my best to paraphrase into the microphone. So I want to know who's first. Stare at people. Do you want to introduce yourself as a way to, so as a reminder too, as she's coming up, I know, way to go, Kate. As Kate's coming up, just this is the reminder to you all in the room. You heard them actually say it, but they're on LinkedIn. I'm 100% positive because I'm connected to all three of them on LinkedIn. So go find them on LinkedIn. If you're like, I don't have a LinkedIn account. XPD has, like, all of you are auto-enrolled in XPD's Canvas page. We have an entire module on LinkedIn. So we can help you with that. But again, literally say, hey, great hearing you on the panel, hoping to connect here as a fellow Benny. And all three of you are going to say, yes, please. Can't wait to buy you coffee. So go for it.
The mic's on, right? Okay. Hi, I'm Kate Fensky. I'm a senior integrative science major focusing in public health and then minoring in political science. I am sort of torn with the idea of what my different options are for grad school. And I think two of you said you had masters in public health. So can you talk a little bit about like how that decision-making process went for you, how you decided that that's what you wanted to pursue, and how you also decided that the University of Minnesota was right for you, and how you decided what you wanted to focus in within public health specifically.
I can start on this one. So for me, as somebody that says I'm a very intentional person, that's one of my values, I feel like there wasn't a lot of intention that came into this. It kind of just like fell into my lap. As a dietetics major, becoming a dietitian was really important to me. But when somebody came to talk about the coordinated master's program, I heard about it, and I heard about that nutrition was combined with public health, and there was talk about upstream of approaches to public health versus just treating the problem. And I was like, okay, I'm going here. And that was just kind of a no-brainer. I didn't really do a ton of research to explore other things. I just heard this. And I think for me, it was more the awareness that public health and nutrition just go hand in hand. I think there's merits to clinical dietitians and doing one-on-one counseling, and those are very important. And I know a lot of folks that do that and do great work. But for me, I just couldn't see nutrition happening without a community approach and thinking about the ways that are prohibiting folks from accessing optimal nutrition. So that was really what was the big factor for me. This specific coordinated program that I did, there's a couple other ones in the US. I think there's maybe only a total of 5. But I really love the University of Minnesota. I always joke that I was terrified because I thought it was way too big. And then I ended up actually staying there, and I worked in the School of Public Health for a couple of years. Yeah, and I really liked that. I thought that the faculty were engaged. I think that there was a good balance of doing the research piece and then also doing community work. Yeah, and it was just really cool having grown up in Minnesota to be able to work in grad school in a community that I knew a lot about. And it was, yeah, to see some of the challenges and know them firsthand. And yeah. Holly, what did you think about CHP?
Yeah, so my story's similar. Once I learned about the upstream approach of public health, so figuring out why things are a certain way instead of just treating them after they happen, trying to figure out why they're happening and prevent that. I decided public health was the way for me. I was not a dietetics major, so I did not do a coordinated master's program because I didn't have the prereqs for the dietitian route. And so I started researching different majors for the Masters of Public Health programs. I honestly looked at schools and where I wanted to go, cities I was willing to move to. I ended up applying to 5 schools and 5 different programs after I researched them and decided what I wanted to do. I chose community health promotion because I really liked the idea that you're working with people, you are working with people of all ages. I love children. I actually coached kids for several years, all throughout college too. And I've also worked in long-term care. And so I love the geriatric population as well. And so I knew I didn't want to focus on a certain population. I wanted to focus on kind of like the entire lifespan and all ages. And so I chose community health promotion so I could do that and be integrated with people who have different backgrounds than me and really learn about others as well. I ended up choosing the U for similar reasons. I almost went to the U for undergrad, and my family were really big Gopher sports fans. So going to the U is kind of like part of what our family does. But also there's some other limitations that prevented me from going out of state. But ultimately, I was really happy to go to the U because it's actually ranked really high as a school of public health. And I was able to be close to my family and friends, and I got to see them whenever I wanted and go home for a home cooked meal. So that was nice. And yeah, I really liked my professors at the U. I learned a lot from them, and it was nice to do that in a setting that I was already familiar with.
Thank you for the next question. I appreciate all of your response because I feel like we hear often, do I have to go to grad school? Sometimes yes, sometimes no. And so I appreciate your honesty that all three of your paths looked really different.
Hi, my name is Mikkel. I'm a senior dietetics major, and currently I'm in the process of applying for grad school. So I just had a question, like, what advice would you have for senior? I know like a couple of years, you probably were in my shoe. Like, what advice do you have for seniors? Like, how should you be spending this time, like this crucial time? Because I'm a little bit, things are a little bit hectic right now. And then also like in terms of campus involvement, do you have like any advice? Are there any clubs or activities that you did in your senior year or even throughout your whole college career that you would say helped you in your journey in public health? Thanks.
Whoever wants to go for it.
Liz, do you want to go first?
Trying to think. A lot is happening senior year. I think say yes to as many things as you can. I know it's like so much going on and like you're wrapping up school and applying for jobs and everything like that. But yeah, I guess just being intentional about spending time in your senior year of college. It's not something that you'll ever get back. I guess campus involvement. Again, just saying yes to whatever interests you. I think it's a good space to try out a bunch of different things to see what you like entering the job space or the types of things that interest you. I think leaving a campus setting, it's a little harder to engage in clubs and organizations like that. But yeah, it's a good space to just try out and see what you like.
I can go. Yes, I echo that. Say yes to as many things. Try to live in the moment as best as you can. It's really, I know one thing I struggled with senior year is trying to balance like school and fun, because there's so many things going on senior year and there's so much going on both like in school and out of school. People are constantly asking you what you're going to do after graduation. You have no idea. So it is a lot. And it took me a while to figure out that I did 3 years of work already, and I put myself in a pretty good place academically that, I was able to take classes I wanted to take and also maybe budget a little bit more time for out of school things. And I didn't have to, study quite as much, I would probably say, although those tests were brutal. But just recognizing that like you have done a ton of work already and you have to do what you have to do to get by, but you don't have to spend 40 hours a week studying for a test. You can break that up. And that was something that was really hard for me in like level setting and prioritizing, like, okay, I have this due tomorrow, so I need to do that. And then I don't need to do the thing that's due next week today. I can do that later. I can go out and like go have dinner with my friends, go to my friend's hockey game. I can do things that are equally as important, but not necessarily academic related, and just finding more balance in that. And just trying to live in the moment, and honestly try not to stress out when people ask what you're doing after graduation. It's okay not to know. It's totally fine. When I graduated grad school, it was 2020 and the middle of the pandemic, and I didn't have a job lined up. No one in my cohort had a job lined up for months, and it was fine. Everything works out. It will be fine. Everything will work out. Just try to live in the moment and try not to stress about things as much as you probably feel like you need to, because it'll be okay.
Holly, I'm so glad that you said that, because the first thing that came up with that question for me was like, be gentle with yourself. I really wish that somebody would have told me that my senior year. I mean, there's so many things. The dietetic internship process is stressful, and writing cover letters, and there's amazing, amazing support. And you have worked hard to get to a place where you can do this. And I'm not, right? Like, that's being gentle with yourself doesn't mean don't try. But just like trust that you have had 3 years to develop habits, and you can trust those habits, and you can know that you can rock out a test, and you can also still find time for your people. I mean, I think that is, we've all kind of talked about the connections, and I think that connections with friends is also so huge. And I think about that too, as I'm still really close with a lot of my St. Ben St. John's friends. And those are the things that I look back on, and I remember those so fondly, right? Those like, oh, let's just get ice cream on a Tuesday night thing. So those are the things that like say yes to activities and the Nutrition Club rocks, and also say yes to hanging out with your friends and things that deviate from your normal academic plan.
You mean life isn't only about your career? I appreciate your honesty, like really collectively on that, because I do feel like, I mean, part of why we pulled you in, and again, thank you for saying yes today, is because we wanted to hear about what are you currently doing? Like what pays the bills? But what we often don't talk about is here's all the things that didn't work out, or here's what didn't go well, or here's what was really hard. And so I appreciate you sharing both your amazing things you do in your job and the things that are hard, as well as the things kind of like looking back of like dinner with friends, going to a hockey game, that those have equally amazing space. So with that, we are like 30 seconds to the end of time. Well, not the end of time, but the end of our time together. And so if all of us here in the room can help thank our fabulous panelists, hopefully you can hear. It's not a reel that we're just automatically playing. So again, thank you all. It is lovely to see you here on the screen. As a reminder to all of you in the room, they're on LinkedIn. And you have really amazing support networks here at St. Ben's and St. John's, whether it's incredible faculty or of course XPD. There's a lot of people on campus who can help you. So thank you all for coming today.